Hey everyone. So I promised y'all that I would do a quick demonstration of what I would consider as my little skeleton cheat sheet or scratch sheet that I would have when I'm doing my practical examination. So remember, 1 hour before you start your 1 hour, 1 minute before you start your practical examination, you're going to be given a blank sheet of paper. You're going to have a blank sheet of paper. You're going to be allowed to write quick notes down so that you have a reference for doing the practical exam for taking the history. And you only have 1 minute, so you can't write this huge, reminding yourself of every little detail. You have to have what I like to call a skeleton, just to give you some reminders as you're going through. Okay, so this is an example of a skeleton that I would use if I was going to do something like that. And you don't have to use it. I've actually had students come into the practical that just do it. They just go from start to finish. My only thing with that is that you can do it great hundreds of times outside of testing situation, but once you get into the test, for some reason it's just so stressful that it can sometimes make it more difficult to recall things. So it's nice to have this little cheat sheet to refer to. So what do I have on here? What does this mean? It's a bunch of letters, right? So I have my intro reminding me to introduce myself to the patient. That's also my wash my hands. All the little things that you're supposed to do when you first come in. So intro, knock on the door, gain consent, wash your hands. If you have time when you're kind of basically what I'm going to have you do is on your own, see how fast you can write this out, how long it takes you. If you still have seconds to spare, you might even write in a W for washing your hands, a V for verify, you might do that, but I just try to keep it to what I know you can fit in 1 minute to write down. Now here's your HPI section. Remember to leave yourself space to take notes in the HPI section, because that is the one section that you're going to have to summarize at the end of. So you don't want to not have room to write anything down here, because you're going to have to look at that. So you can either put your old cards or your locates. Don't forget the different components. If maybe there's more than one per letter, you might do that as well. Just tailor this to your approach. And then I always put like something to remind me to summarize. Okay. My lines here are my reminders to transition. Okay. So on this one, I would actually take notes. I would put like head, yesterday, I would actually write it down. Once I get past this, I'm just going to put check marks. Okay. So history, your past medical history. When I ask about allergies, I'm going to check it. When I ask about medications, I'm going to check it. Illnesses, check. Immunizations, check. I'm going to do that. Transition. This is my family history. So I have my father, mother, and then paternal grandfather, grandmother, maternal grandfather, grandmother, siblings, children. And I'm just going to check them off. Check, 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 making sure that I don't miss anything. And then I also put on here those extra 3 things: the psych, the alcohol, and the drugs. Okay. Moving up to here, your social history, I put my sad ones, and I'm just going to check them off as I say them to make sure that I'm reminding myself to do all these. Now, the review systems is the area that you're going to have to tailor to how you do it, whatever you like the best. What I was just showing you is just an example. So for me, this would be a reminder. I'm going to do general, H, head, ears, eyes, nose, throat, respiratory, cardiovascular, GI, GU, endo. So you can do it however you want. I think this is an easy way to just remind yourself. And what I would do here is, as I ask the general, you're going to have to ask all of them. The H, head, I would say like, have you had any hair loss? And I would check. And any night sweats, check, or whatever it is. And then move to the next one. Any vision changes, check. Any red eye, check. Okay. And then move on to make sure I have 2 check marks next to everything. And for general, that I have all of them. And then, of course, I wrote to breathe, because I want a reminder that I need to relax and take my time, but not too much time, because your time. And that's it. This is what I would use as a little skeleton. So that was a 5 minute or less little demo on how I would prep myself to succeed in my practical examination. So if you have any questions or maybe some suggestions to modify this, put them in the comments below so that your classmates can see it and so that I can see it. And we'll see you in the next video.